I'm Chance Dorland, and this is In-Depth, an interview program from ExpressNews.com with in-depth reporting and other resources for stories affecting San Antonio and Bexar County. While a growing number of Bexar County families have incomes above the poverty line, many still struggle just to get by, with 1 in 3 Bexar County families not having enough for basic essentials. In San Antonio, that number is even larger, with half of all Alamo City households struggling to pay for those basic necessities. I'm joined now by San Antonio Express News general assignment reporter Melissa Fletcher Stoeltje to learn more about these and other findings of a new study. So, Melissa, great to have you back here for the second time on the In-Depth podcast. Let's start with this new data. Where does it come from?
Well, Chance, thanks for having me back. So, this study was done by the United Ways of Texas. So that's an amalgamation of all the different United Ways in the state, using things like census data and lots of different information from different sources. That's how they came up with these numbers.
And so when we talk about basic necessities, obviously I'm guessing that would cover food and housing, but what types of things are we talking about?
Sure, it's not just the basics like food and housing, but it's things like childcare, which we know is so important for people that are working, transportation, any of the extras like saving for a rainy day, saving for a child's college. It's really a whole range of things that these folks can't afford. And one way to think about this, Chance, is they're people that are living in a gap. They don't make enough. They make too much money above the poverty line to qualify for things like food stamps or subsidized housing, subsidized childcare. But they don't make enough to really, subsist and thrive and prosper to kind of get ahead and get their families to get ahead. So they're stuck in this gap area.
Yeah, and to describe people in that gap area, I often hear the term, and when I was growing up, I think I remember hearing the term working poor. But this new study coins a new term.
Right. They call them the ALICE group, and that stands for Asset Limited Income Constrained Employed. So it's just sort of a handy label to use for these folks. And really, if you're in the ALICE cohort, you're going to have an annual income above the poverty level, but below $59,952 for a family of 4, or $1,096 for an individual. So there's quite a big range, but they came up with this sort of label to really kind of give a face and a name to this group of folks that are really struggling in Texas.
I already briefly mentioned a few figures, but now we can talk about them more in depth. This study really talks about Texas as a whole. It breaks it down into counties. Specifically, we're talking about Bexar County, and then it also talks about San Antonio itself. There's some discrepancy in those numbers. Is there any specific reason, and what are those numbers?
Right. So the ALICE cohort in Bexar County is 36% of all households. But when you go down to San Antonio, it rises to 55%, which is about 500,000 households. And that's because when you just look at the city proper, you factor out all those sort of affluent bedroom cities like Castle Hills and Terrell Hills, Alamo Heights, and also sort of the county donut that surrounds the city. There's more affluence there. So you factor that out, the number goes up, and that's why it's so much worse in the city proper. There's more working poor and more poverty-stricken families as well. What's interesting also is that I gave the number for the ALICE cohort in Bexar County, the 59,000 and the 20,000. The Texas number is actually lower than that because, again, you're factoring counties like Hidalgo County, all those counties around the border that are even in more dire straits than San Antonio. So the Texas numbers look a little bit worse. So it's a lot of the numbers, but the basic message is there's just a whole lot of people that are working, sometimes 2 jobs, and still not, getting that American dream. They're still trying to make it from month to month, paycheck to paycheck. And then the kids get trapped and not getting the extras like tutoring and, all the kind of things that middle class and upper class families sort of take for granted. These kids and these families don't get it.
Yeah, to go back to what you already said, kind of that gap that these families are stuck in, just to use a bit of anecdotal information from my end, I've lived abroad a lot. I've lived in Europe, I've lived in Latin America, I've lived in Asia. And one of the things that I've really learned doing that, well, I've learned quite a lot doing that. I really encourage people to spend some time abroad if they can.
I
It's
agree.
really, eye opening in a lot of different ways. But one of the things I really learned, specifically, I'll use Germany as an example. In Germany, in a lot of ways, it seems like if you're poor, you're kind of better off than middle class or
Hmm.
lower middle class in the United States, because when you're in these gap areas, you might not be getting free lunch at school. You might not be getting, as you mentioned already, food stamps. You've already spoken about this, but I really think it bears consideration another time around. These people, they're working, but they're not really able to get any of the benefits that they'd be getting if they, as you just mentioned, if they were a little higher on the economic ladder, or if they were a little bit lower.
Right, like in Texas, we know we didn't expand Medicaid, right, with Obamacare, and so a lot of these families struggle with health care. Now, if you're very poor, or if you're a mother with kids in Texas, you might qualify for Medicaid, but there's lots of other folks that are in the Medicaid gap that you hear about here in Texas, where they don't, they don't have the kind of health care that people that have good full time jobs get. Like, there's a really striking number that came out of this study that found that 62% of jobs pay less than $20 an hour in Texas. And so low wages, lack of universal health care really hits this Alice cohort hard. And you're absolutely right. You go to other places, other countries where they've got universal health care or socialized medicine, you don't find these kind of families struggling because they can't afford good health care. Their jobs don't provide good health care. So, yeah, if you're poor in Texas, you can qualify for things like Medicaid, WIC, subsidized housing. A lot of these families in Alice, they can get things like an earned income tax credit, which is really important because they're working, right? And they have children. And there's a few other things, but by and large, they are not eligible for programs like Section 8 housing, other kinds of health care. And so they're just really, they're stuck. They can't move forward at all, or, have that kind of prosperity that other people take for granted.
And in your recent write up in the San Antonio Express News, that's also available online at expressnews.com. You can look it up. It's called One in Three Households in San Antonio Struggle to Afford Necessities. You specifically talked to one mother, and one of the things that she mentioned, and I know this is probably very common, but just reading that, it really struck true with me. If you're working these jobs, or maybe you're not making as much money as you need for your family, if your child is sick, maybe you don't work that day.
Right, that was Crystal Alvarado, and she had a great job, pretty good job for 7 years working in a private detention center in Pearsall. But she had to get up at 3 a.m. every day to take her four kids to a sister's house in San Antonio, and then to drive all that way. And so she was just working herself to death. She never saw her kids. One of her children started getting bullied at school and sunk into a depression. And Crystal was so busy and exhausted working, she didn't even notice what was going on until things got really desperate. And so she would have to call in sick, and would be reprimanded. And so this sort of swirling spiral of shame and exhaustion really, really took a toll on this family. And she was making $21 an hour, but that only averages out to about $48,000 a year for a family of five. So she was definitely in the Alice cohort, and she finally just got to the end of her rope and had to quit. And now she's living with a sister, and ironically enough, is getting food stamps and other kind of help now. Like you said earlier, if you're poor, there are things that I'm not saying being poor is by any stretch a good thing in Texas, because we have very, very minimal benefits, but she's getting the kind of help now that she couldn't get while she was working. So she's trying to find another job here in town that, has less hours, so she can, balance her work and her home life better. So an interesting number, when you combine the Alice households in Texas with the families that live the federal poverty line or below, that's 42% of the population, or more than 4 million households. But when you look at Bexar County and you add together the 36% of the Alice households with the 15% that are in poverty, that's 51%. So that's over half of our families are struggling. even though the poverty rate actually, interestingly enough, has kind of gone down. It was 16% in 2010, then 17% in 2012 and 2014, and then this last go round it was 15. So poverty is slightly declining, maybe because of the economy, but still over half of our families are struggling. So that's just really an indictment of what's going on here in Bexar County, and really largely what's going on in Texas. People need more help.
And then I remember specifically you mentioned the earned income tax credit. That's something that can help people who aren't at the very, bottom where they're getting all these benefits, but they're in that gap, working poor Alice, as we've been talking about. What other kinds of services are available either in San Antonio or Bexar County? I assume a lot of these would probably be private entities reaching out to the community.
Right. The faith-based community tries to help out with things like food pantries and the United Way has a lot of different programs. I know Crystal got some free counseling. Her daughter did through the neighborhood place here in town. There's all kinds of free classes on budgeting and saving. So there is help out there through nonprofits. We have a great nonprofit community here in San Antonio and a lot of great, faith-based organizations. It's just that people often don't know about it. They don't realize there's help out there. A lot of them are so busy working and trying to care for their families, they don't ever reach out. So I really do encourage people to call the United Way to find out. I think the number is 311 to find out all the different kind of programs that are out there. Crystal and her daughter also got some help through a school-based program. So, people aren't alone. And if the government's not going to step in and help, the nonprofit community here certainly does. But people have to reach out.
And then finally, before we say goodbye, a chance for final thoughts. And then I'm wondering if, Crystal, the family you spoke with, or anyone else that you spoke with for this reporting, or any other related reporting that you've done for the San Antonio Express News, did they have any specific things that they thought would really help, these families, these Alice families who are in this gap of making too much to receive a lot of benefits, but not enough to cover their basic necessities? I'm guessing, higher wages, or as you've been talking about, more resources from the state would help. Is that what people are saying as well?
Right. And, what's interesting, Chance, is that, San Antonio is in the midst of a tech boom. A lot of young people are moving here, a lot of millennials. The economy, despite kind of chaos that's been happening at in Washington and elsewhere, the economy is booming, but, minimum wage hasn't changed in, decades. It's still $7.25, $7.50. And so some states and some cities are, jumping on the bandwagon to move wages up to $15 or more. You say, what do poor people need? Well, they need more money. That's a basic thing that could really, really quickly help people, is to raise minimum wage, raise wages. So other folks can, be part of this prosperity that's happening all around San Antonio and the nation. I know that the United Way here in San Antonio and Bexar County, they're going through a pretty big change over the next couple of years, where they're really going to be honing in on accountability for these nonprofits, these agencies, to really show that they're helping, people in poverty, and then this Alice cohort really having to redirect their giving, and they're really going to be holding these groups accountable to show that the work they're doing is having a tangible impact in families' lives. Because really it comes down, that's where the rubber hits the road. How are you really helping families in their day-to-day lives? And I know the United Way is really going to make a big study of that in the next the year or two coming up. And I think that that's a really good idea, that we need to make sure that we're doing targeted help. These families need childcare help. If your child's sick and you have to work, what are you going to do? If you can't afford childcare that you trust, you can't afford transportation to get to your job, you're really sunk. So we've really got to focus on these basic things that folks need, especially these people that are in the gap that really are kind of doing it on their own. So I'm hoping that this study is going to help start a conversation. That's what they want us to do. They want to, raising wages is great, but it's going to be a holistic approach that I think this conversation really is going to focus in on.
And thank you to San Antonio Express News General Assignment Reporter Melissa Fletcher Stoeltje for joining me for today's episode of In Depth, an interview program from expressnews.com. For the San Antonio Express News, I'm Chance Dorland.